Got some breaking news to report. The Associated Press is reporting now that one person has died from the measles outbreak in West Texas. We've obviously been tracking that outbreak there for several weeks, which has grown to more than 100 cases across 9 different counties. I want to bring in CBS News correspondent Omar Villafranca, who's been tracking this story for the last couple of days for us. Omar, what are you learning? Tell me about this person, if you have any information about this person who succumbed to this illness.
Well, right now, Vlad, Lubbock Covenant, which is the hospital here in Lubbock, it's a children's hospital. A spokesperson for the hospital tells us that they are not confirming anything and they don't know where AP got that story, but they are telling us that there is a 3 o'clock press conference. We've also reached out to city officials, county health department officials, and state health department officials. And everything is quiet right now. They're not confirming anything or telling us everything. Hopefully we'll learn before that. If not, hopefully at that 3 o'clock press conference.
You know, Omar, I was watching your piece this morning on CBS Mornings, and as you know, we had Dr. Celine Gounder on to talk about this. And I asked her in the break if we're to assume that the people who were stricken with measles in your reporting and the other reports that we've seen are folks who were unvaccinated, because that seems to be a question that I'm never clear on. Are people getting this because they're not vaccinated, because their children are not vaccinated?
Well, and what we said in that story, Vlad, is this started in an unvaccinated Mennonite community that's in Gaines County, county seat being Seminole, here in West Texas. So that's a community religious, and their choice is to not get vaccinated really for anything. They don't have to go to public schools. They homeschool, so that requirement, there's no exemption that's needed because they don't go to public schooling. Most of them are homeschooled. The majority of the cases that have happened in Gaines County are from that Mennonite community. The thing is, they interact with the general public. They'll go to a big box store or Walmart to grab groceries. They'll go to grab supplies in other places, and that's where they will run into people. Now, some of the early numbers that we saw from the state is that most of is hitting children in the community, 17 and under. I mean, I'm talking a majority of the cases are children, but people who are getting it, who are not part of the Mennonite community, could be getting it if they were not vaccinated themselves. We've seen vaccination rates drop several points here over the last 10 years, almost 10 percentage points. So that is going to have an effect. And I'm sure Dr. Gounder said that the best way to fight the measles is getting the vaccine. It's much better than other vaccines. To compare it to COVID, you could get a COVID shot, but you could still get COVID, and the symptoms wouldn't be as bad. If you get the measles vaccine, there's a 97% chance you will not even get measles. If you happen to get a breakthrough case, you will not be able to transmit it. So that's why health officials across the country, really here in the state right now, are opening up testing, but also having the vaccine readily available for people who want it.
And so the question, of course, becomes, what are health officials saying about how they are working to contain this outbreak? Because the other thing that Dr. Gounder told me, which was sort of interesting, is that once you have measles, actually it weakens the immune system so much that you are now susceptible to a whole host of other illnesses that might come afterwards.
Well, right now what they're doing is pushing testing in certain counties that are high hit, and also having clinics where people can go in and get the vaccine. In Lubbock here, they told us last week they were averaging roughly 20 people a day coming in to get the measles vaccine, which is a pretty good number for people to come in. Mind you, this is happening as state lawmakers are meeting in Austin, and they meet once every 2 years. So I can guarantee you state health commissioners are talking to lawmakers to see about what can be done, because while they're meeting in Austin, this is the biggest measles outbreak in more than 30 years in Texas, and it's happening in West Texas.
Wow. All right. Omar Villafranca on the story for us this morning. Thank you, Omar, for jumping in front of a camera with the breaking news. We appreciate it.